Welcome to the Leadership Academy for the Public's Health Masterclass Series, Tapping the Power of the Arts and Culture in Improving Health for All. My name is Merlene Tucker, and I'll be running today's web forum along with my colleague Jeff Bornstein. Today's web forum is sponsored by the Leadership Academy for the Public's Health, a program of the PHI Center for Health, Leadership, and Impact, and produced by Dialogue for Health. Let's meet the moderator of today's event, Kathy Slemp. Kathy is a coach and advisor for the Leadership Academy for the Public's Health, a program of PHI Center for Health, Leadership, and Impact. Welcome, Kathy.
Thank you, Merlene. It is wonderful to be here today. And I really want to send a great welcome to all who have joined us from truly around the country. So good morning, good afternoon, depending on where you are. I think we are truly all in for a real treat with both the topic itself today and the power of our presenters. And I will tell you, it has been a joy to get to know each of them. And I have no doubt that they will really spark creativity and inspire ideas in all of us today. So please do join in during our session. Share your ideas and questions that it raises through the Q&A box, as Merlene shared with us, because we really do want to be a true learning community and will benefit from the thoughts and the ideas and the questions that you all bring. So as Marlene said, I am Kathy Slemp and have the honor and the privilege of working with the Public Health Institute's Center for Health Leadership and Impact as an action learning coach. And our panelists today come from teams across our now 13-year history of running both the National and the California Leadership Academy for the Public's Health, affectionately known as NLAPH and KLAPH. You'll hear us refer to those as. So with our slide on the Center for Health Leadership and Impact, I'll tell you a little bit about those programs. Our mission truly is building healthy, equitable communities and creating sustainable impact at scale. And we take that mission really very seriously, and that the work is really grounded in and has a focus on advancing health equity and on community at its core. So we do this work understanding that advancing health really requires shaping a wide array of conditions that allow all of us to thrive. And it's about helping to have intersectoral work at the community level. So the first master class that we had in this series actually was a webinar on specifically that partnership development and community engagement. And so that that can be found on the Dialogue Health website if you're interested in going back to see that one. But this is a separate one. It'll be a standalone. So whether our work is through NLAPH or KLAPH or offerings like this masterclass series, our real goal, I think, is to help all of us keep building on the individual skills we bring to our partnerships and to more fully appreciate and draw out the gifts that others bring as well. And we also then want to provide some tools and partnerships and supports and really the reflective space, I would say, that helps us align our efforts and transform communities in really, really practical ways. And I think you will hear that from our panelists today. So our topic today, tapping the power of the arts and culture and advancing health for all. While it doesn't serve as a standalone topic in our programs, it really does weave, I think, through much of our curriculum in a very timely way throughout our work. So you see here some of the core parts of that curriculum. So whether arts and culture are used to help actually prioritize and develop strategy, or to build partnerships and raise the voice and the agency of communities, whether it is used to build relationships within coalitions or communicate the data in very interactive and clearly understandable ways, or whether it's used to guide action and actually be the action that creates change in community. Arts weave through all of that and have incredible power to do so. As we think about this work, It really is incredibly relevant. I think that arts and culture is already reaching people in unique and creative ways that we often don't realize are happening day in and day out. And so they can reach organizations and partnerships that we don't have. There is increasing evidence that it can be incredibly effective and helpful, and do a incredible ability to really strengthen what we do together. So let's jump in. We have a fantastic group of panelists talking about everything from use of the arts to increase community agency and voice, to driving policy change, which we're going to hear about in a minute from Josh here, to supporting advocacy, which we'll hear about from Laura and others, to using the arts to heal and build relationships within teams and coalitions, to sparking creativity and innovation, to designing healthy spaces, etc. So as you might expect, our three panelists are going to be coming from three different sectors: the arts community, the planning community, and the health community. And yet they all really work at that intersection, formally and informally, no doubt. What they all have in common is that they have served as fellows in their LAPH programs. And while they're going to touch on their LAPH experience, they really also will talk about their work at the intersections of health and culture more broadly. Josh is the co-founder and CEO of Ideas X Lab. There's a host of projects you're going to hear about from him. But besides his LAPH experience as part of the Louisville Lead-Free Community Team in 2021, I think that was our 10th cohort, he also has achieved a variety of other things. They've been a Soros Equity Fellow, a nonprofit visionary leader, a Business Equality Magazine's 40 Under 40, as well as the LGBTQ 40 Under 40 for Louisville's business group. So Josh is going to share some really exciting work that they have been doing in this arena. Our second panelist is Laura Dewberry. Laura is a community health worker and a mentorship co-chair for the Mosaic Initiative in the Centene Corporation. She is well experienced in both personal and professional experience in this arena, and works actively in Michigan, in Detroit, as a community health worker, and with the Michigan Community Health Worker Alliance. She is an active member of the Michigan Public Health Association, and she has managed a host of programs, as well as served as a health equity fellow with our LAPH program as part of the Michigan Health Equity Team in 2022, I think our 11th cohort. So we are really excited to have Laura here with us today, and as many of us are, as we can see from both Josh's and Laura's reactions. You all have had lots of impact and connections and relationships across communities already, and we're just building on those today. Our third panelist is Miguel Angel Vasquez. And Miguel is the Health Equity Urban and Regional Planner with the Riverside University Health System. And Miguel is an urban planner by trade. So that's a third sector. We've got the arts sector, the health sector, and the urban planning sector. He is really a planning and health integration expert. He's an artist himself and has explored a lot of work in this arena and really been a leader with that. He's the recipient of several awards: the APA President's Award, the California Distinguished Contribution Award, a prize from Cal State Polytechnic, and Miguel was actually a member of the first cohort of the LAPH Leadership Academies. So he was part of the Eastern Coachella Valley team back in 2012. So our format today is that we've now introduced the full panel. Each panelist will present, and then they'll be handing it off to each other. As you hear their presentations, please don't be shy to engage. If you have a comment or a question it sparks, go ahead and put it in the Q&A box as we go while it's fresh. You don't need to wait for the end. Those questions that you put forward really will guide the panel discussion that will follow. And it'll help us all really engage as a fuller learning community. So without further ado, I am going to hand it off to Josh and as we begin to learn from our crew. So Josh, it's all yours.
All right. Well, thank you, Kathy. Thank you, Merlene. Happy to be with everyone today. I'm Josh Miller, they, he pronouns. And I'm going to be talking to you all about an arc of work over the past 7+ years that brings together this intersection of art and collaboration and public health. So as a little background, I am the co-founder of Ideas X Lab, and we use the art of storytelling and community collaboration to impact public health. And we've thought about the ways that we can create impact across and with communities in a lot of different ways. So thinking about how art and storytelling and collaboration can impact hope, sense of belonging, self-determination, policy change, and support racial healing and reconciliation. And so they're going to drop a few links in the chat throughout the talk. If you want to learn more about the different ways that we've been doing that work, you can check out Ideas X Lab's 10-year report that we put out at the end of last year as we celebrated a decade of doing this work. And I'm going to kick us off with talking about an initiative that we launched in 2017 called One Poem at a Time. And so this led into an ongoing collaboration with the Louisville Metro Department of Public Health and Wellness, and was part of what our LAPH team focused on. So historically, or for over 12 years, I was based in Louisville, Kentucky. I now live in Denver, Colorado, and go back and forth. But we in Louisville were partnering with the Smoketown neighborhood, the oldest continuous African-American neighborhood in Kentucky, and where our team member, Hannah Drake, had multiple generations of family history. And so we started doing different community events that were arts-based to understand what the community priorities were. And one of them that they talked about was beautification. And as we kind of drilled down into what the details of that meant, we started asking about the billboards and the outdoor advertising. And we said, do you all notice these? And they said, yes. And we said, what do the billboards in the neighborhood make you think about? And you can see the visuals. There were billboards for drug sniffing dogs, for cheap lawyers, for gun shows, signs for we'll pay cash for your house. And some of the respondents in different ways talked about how these signs made them think that it was a community with low self-esteem. And this is coming from people in the community about the messaging that they were receiving. And so one of the questions that we asked was, what could we do together to envision a change in the environment and then to push toward policy change? And that's how we created One Poem at a Time. And part of why we focused on mitigating the impact of outdoor advertising is because we did a health impact assessment. And part of what we found is that in a similar way that lead creates an environmental toxin, toxic outdoor advertising creates a social toxin and impacts our view of community, our relationship to each other, investment in the community, and view of our community from outside of it. So what we did was partner with community members, and we said we are going to work together to create a series of billboard designs featuring faces of community members. This first campaign included some historical photos from the community and one sentence or phrases that represent what the community wants to say to each other. And so one of the ones that came to the forefront and became a slogan for the community was, "You are worthy, worthy of everything." And so we worked together. We all created 12 different billboards that were installed throughout the community, and then held a historic poetry walk. Policymakers were invited, leaders from Metro government, community members, artists, and we walked the neighborhood so people could physically see the space. They could see the contrast in the new billboards that we all worked on together in contrast with the existing billboards. And that began a conversation around policy change. How do we come together to use our collective power to determine what the physical space in the environment looks like specific to outdoor advertising? And just as these conversations were starting, we looked across the street and 2 liquor stores basically overnight put up signs that they had that said, alcohol for sale. And they had both applied for liquor licenses. Nobody knew about it because of the existing notification policies. And within 30 days, their applications were going to be reviewed at a state level. And so because the community had already started organizing around policy change, the policy change shifted to let's work together to mobilize to defeat these liquor stores from selling more alcohol in a community already impacted so negatively by alcohol. And we submitted over 5,000 letters in protest. There were press conferences held, and we were able to defeat both of those. Just a few months later, Family Dollar applied at over 10 locations to sell alcohol. The community mobilized again, and were able to defeat those. So what we ended up having put in place at a city level was that the notification policy shifted from a white printer-sized piece of paper going on your building and an ad in the back of the Courier Journal that was like an inch wide, and that was your notification for people to be able to object to an application, to these huge yellow signs, this canary yellow 2-foot by 3-foot sign being posted on the public facing part of your building so that community members had adequate time to voice their concerns. And then again in 2024, Family Dollar applied again for over 20 locations to start selling alcohol. And because the community was familiar with this process, it was one they had worked through before, they were able to come together and to defeat those applications as well. So this was a really cool example of seeing how the power of arts and bringing people together and envisioning a change then spurred and led to policy change, even if it wasn't the initial policy that we all thought we were going to work on together. What that initial One Poem at a Time campaign did was seed an ongoing partnership with Louisville Metro Department of Public Health to think about how do we use this type of community engaged reflexive process using art, using collaboration to continue to highlight and improve public health outcomes. So over the past few years, we've worked with them on a variety of campaigns, and you can see some of those billboards featured on here. We did ones for smoking cessation, we did some for diabetes prevention, but our last few have all been focused on childhood lead poisoning prevention, and that's been our big push. So we have expanded the scope in terms of the number of communities that we've been partnering with, working to make campaigns bilingual or multilingual, and really thinking about all of the different collaborative ways that art can support this type of process. So in all, through combining storytelling and this arts and public health approach in collaborations with organizations in the community, community members, and Louisville Metro, we've created over 40 plus billboards over the past few years, and also started leveraging digital ads that were geofenced based on the zip codes, where we were really wanting to reach people because the prevalence or the potential for lead being in the environment was the highest. And what we saw as we integrated digital ads was that those performed 300 to 1,000% better than the industry standard. So digital ads with the faces of community and the message of community demonstrated a really great performance in terms of navigating people to public health resources. Overall, the campaigns have had over 20 million impressions, digital ads, and physical billboards. We saw over a 900% increase in website traffic to the Louisville Metro Department of Public Health led specific website page. And we also saw an 80% increase in children being tested for lead poisoning, especially at a time when during COVID, there was a drop off in testing in general and also in vaccines. And so it's been really exciting to see how this campaign has evolved and how community has championed and participated in this effort and this collaboration. I'm not going to delve into all of the details of this motif model, but you will be able to access in a link a research article that we co-authored that looks at the process we used for one poem at a time and created a model that looks at mapping policies that created the social toxins, like I mentioned, orienting towards culturally responsiveness through arts. So really thinking about how does the place and the people determine what the messaging is, translating all of these different actions to think about how does it align with cultural well-being and evidence, like we talked about with the health impact assessment. This is a very iterative type of process. When we create the campaigns, we go back to the community partners that we've worked with to validate is this the messaging representing what you all want to say to each other and the experience that you have, so that there's ownership in that, and thinking about how all of this fosters well-being. So that is available for you in the chat. And in our most recent campaign, we had collected hundreds of responses from the community about what makes a healthy home, what makes a healthy community through our different arts engagements and activities. And we also had the childhood lead poisoning prevention educational materials. So we handed both of those sets of information off to a group of social justice performers, young people in Louisville, Kentucky, and they created a specific song called Opened Eyes for our most recent childhood lead poisoning prevention campaign. And they also created a music video. So I'm going to close out my time with sharing that video so you can see an example of another way that we're using arts to spread this message and to think about how do we impact public health, doing that in collaboration with community members.
This PSA is brought to you by the Mighty Shades of Ebony. Many small children are being poisoned due to the lead in the paint. There are free supplies to get your home tested. Contact the Louisville Metro Department of Public Health. In order to fix these problems, we gotta stick together and stand up.
Your zip code should not determine your health. Land moves stealth, fear the statistics. From 05 to 21, 10,000 children got sick. Real facts in these verses. Don't wanna see my baby brother in one of these hearses. Let's organize around these generational curses. Who get hurt the most? Children under 6, lead in the paint inside of tenement bricks. Any place but before 78 might be hazardous. I'm telling you straight, get your home tested before it's too late. Hey, we gotta stand up and advocate for ourselves. Hold the landlords accountable, clean spaces for ourselves. We gonna make it, we about to break it. Like a diamond under pressure, we ain't breaking. We gotta face it, don't got to take it. Put the policy to the problem, we erase it.
Seeing is believing, I believe when I can see it. Help the kids of our future and prevent this, believe it. Go to stopleadloo.com, we can't trace it. This is for our future, healthy kids are amazing. We gonna make it, we about to break it. Like a diamond under pressure, we ain't breaking. We gotta face it, don't gotta take it. Put the policy to the problem, we erase it. Seeing is believing, I believe when I can see it. Help the kids of our future and prevent this, believe it. Go to stopleadloo.com, we can't trace it. This is for our future, healthy kids are amazing.
Hold on, wait, still. Lead paint in your house is moving in stealth. Environmental injustice is bad for our health. You don't need an iPhone to feel worth in yourself. In the long run, it's still generational wealth. Self-care and love, take care of your health, your mental health, and your neighborhood self. My city need a step. We calling out to the people, take time off and love yourself. Information is empowerment, let's go out and clean up our environment. Equity for the children, let them live to see retirement. Let them live to see retirement, let them live.
Seeing is believing, I believe when I can see it. Help the kids of our future and prevent this, believe it. Go to stopleadloo.com, we can't trace it. This is for our future, healthy kids are amazing.
Hey, lead in our homes, robbing babies of the future, whoa. Said they really need to make it there. Pregnant mamas touching these ties and told up this ain't fair. Time to stand up, time for someone to care. Don't let your mind be passive, the problem is massive. Let's look to the future, forget about the past. Let's make something happen. Don't sit around, get plans abound. Get your kids tested, don't neglect it. Build healthy communities, it starts with us. Safe homes, fresh food, and neighbors that you trust. A healthy family, you deserve it. Advocate for yourself, cause you're worth it.
You are.
Seeing is believing, I believe when I can see it. Help the kids of our future and prevent this, believe it. Go to stopleadloo.com, we can't trace it. This is for our future, healthy kids are amazing. We gonna make it, we about to break it. Like a diamond under pressure, we ain't breaking. We gotta face it, don't gotta take it. Put the policy to the problem, then we erase it.
So that video was from our most recent campaign. I think they'll put the link in the chat if you want to check it out again later. But thank you all for that. I'll close out my time and go ahead and hand it off to Laura Dewberry.
Thank you, Josh. That was a great presentation. I almost had to contain myself when the beat dropped. So I love that. Thank you so much for sharing that with us. So good afternoon, everyone. My name is Laura Dewberry, and I am a community health worker here in Detroit, Michigan. And a lot of my work is dedicated to addressing social determinants of health, face-to-face with the community, as well as serving as their advocate in medical settings. So concerns related to food insecurity, housing, access to medical care. My role is to work directly with patients to remove those social barriers to care so that they can adequately focus on their health. And while I am not directly involved in the art world, I have seen firsthand how art can impact mental health and community engagement, specifically the relationship patients build with their medical team. And so today I want to spotlight influential Black artists whose work highlights historical healthcare injustices and shed light as to why BIPOC communities, specifically why African-American communities, approach the healthcare community with hesitancy and distrust. And simultaneously, I'll also work through some practical strategies that I employ as a community health worker to foster trust and collaboration between medical institutions and our communities. So I wanted to begin our presentation by sharing this quote by Denise Smith, who is the Executive Director of the National Association of Community Health Workers. The quote says, "You cannot understand the trust, commitment, expertise, or authenticity of community health workers without considering the populations and communities from which they originate, those which have experienced historical and structural marginalizations, othering, stigma, and oppression, and barriers to social drivers of health and well-being." And I wanted to share this quote because, excuse me, the quote really demonstrates the unique benefits that the community health workers bring to the public health workforce, but it also sort of helps sets the tone and the stage for the important historical messages within the artist content that I'll be sharing today. So the first artist that you'll see on the screen is an artist called Bryce Detroit. Bryce Detroit is a local artist here in Detroit and community activist who created the sign "Hood Closed to Gentrifiers" in 2020 to raise awareness about gentrification in Detroit. His campaign in 2020 highlighted the urgent issue of gentrification in Detroit and its threat to historically Black communities. Detroit is a historically Black community, and as a resident of Detroit, I will tell you that Detroit has faced a significant increase in gentrification over the past decade, resulting in a severe loss of affordable housing, a surge in homelessness, further deepening the economic and health disparities among BIPOC populations. And so as a community health worker, I can also tell you that I witnessed firsthand the impact of gentrification daily, with housing assistance and concerns related to housing being amongst the most referrals that I receive daily. A lot of this is due to individuals from outside of the community, rising rent prices, landlords selling their properties, forcing long-term residents out of their neighborhoods. We also have a significant homeless population here in Detroit, where the wait list for subsidized housing can be years long. If there are any other CHWs or social workers on the call, they'll tell you the same in other cities, that the wait list for Section 8 or subsidized housing can be extremely long, leaving residents struggling to find affordable housing. And so Bryce's campaign with the sign "Hood Closed to Gentrifier" really underscores the vital role of public health in addressing housing instability and advocating for equitable community development. I also wanted to note that during the pandemic, Bryce used the visibility of his signs to organize virtual public health programming, fostering critical conversations with the community and city council on health impacts of gentrification. So the next artist is Robert Tom. And in 1952, Robert Tom painted this painting, which is called "The Gynecological Surgeon," depicting J. Marion Sims, known as the godfather of gynecology, who advanced the field of gynecological health by experimenting on enslaved Black women without anesthesia or consent in the 1940s. So in the painting that you see here, Tom captures the unsettling scene of Sims and two other white physicians performing a medical procedure or examination on enslaved Black women. The artwork serves as a stark commentary on the exploitation of the mistreatment of Black women's bodies in the name of medical progress during the 19th centuries. And so many folks in the Black community will say that the only difference between this period that Robert Tom has depicted in the photo up to date would be time, right? And so we know for sure that in public health, Black women and Black infants suffer from mortality 3 times more than white women and babies, despite their socioeconomic status or educational background. We also know that in public health that Black women have higher rates of mortality in cervical cancer, as well as they are less likely to seek out medical intervention for infertility concerns. And so for me, this artwork highlights the profound impact of racism and bias in medicine. And as a community health worker on a daily basis, I've seen a growing awareness among Black women within their medical care. A lot of Black women are now seeking Black OBGYNs and really sort of requesting and demanding more cultural sensitivity from their medical providers. And my role as a CHW every day involves connecting patients to culturally competent services while also using these historical examples as a data point to encourage advocacy for their health. However, it's important to note that the responsibility for safe and culturally competent care lies within the medical community, not just the patients. And so Robert Tom's artwork commands our attention to the ongoing mistrust in medical systems and underscores the need for cultural shift to ensure safety and trust for all in the medical system. And I also wanted to mention that this painting was used as a cover photo for a book. Some of you all may have seen this before. And the book is called Birthing a Slave, Motherhood and Medicine in the Antebellum South by Marie Jenkins. So the next artist that I wanted to introduce you all to is Michelle Browder. And so Michelle really reimagined Robert Tom's gynecological surgeon painting and created a 15-foot iron monument in Montgomery, Alabama to honor Anarcha, Betsy, and Lucy. These are the 3 women who were frequently mentioned in J. Marion Sims' medical writings and endured experiments without anesthesia from 1846 to 1849. And so I'm going to go to the next slide to give you a closer view of the intricacies of this particular monument. So to the top of the photo are 3 depictions of the 3 enslaved women that Michelle is choosing to honor. In the middle, you'll see Anarcha, who was only 17 years old when she underwent 30 surgical procedures over 5 years at the hands of J. Marion Sims, who used their bodies to advance his career and cater to the slave owners' economic exploitation. And so this art is so important because Browder's work demands our attention with it as it relates to highlighting the extremely harmful myths, such as Black patients having a higher pain tolerance than white patients, leading to the undertreatment of pain in Black patients. Also, this work highlights the diminishing of the medical and social concerns BIPOC patients experience as it relates to their medical care. And so within these photos, her statue depicts each woman with their chins raised high, symbolizing dignity. Some of the features carved into the statue are iron-like men, together representing the transatlantic slave trade. And I also wanted to bring your attention to Anarcha in the bottom 2 photos. Her statue has a deliberate hole representing a wound from surgical procedures, surrounded by sculptures of tools like scissors and chains, symbolizing the trauma these women endured without anesthesia. And so Browder also adorned the statues with African symbols, roses, beads, braids, and cornrows to celebrate Black womanhood and femininity, adding beauty and cultural significance to those pieces of art. And Michelle's artwork serves as a data point for the lived experiences of BIPOC communities as a transformative shift towards equitable healthcare practices and communities. And so in addition to the iron monument, Michelle also repainted the previous photo that I shared. However, in this photo depicts J. Marion Sims in an alternating position as the patient undergoing the experimentation, while the Black women are now the surgeons. And she renamed this piece the Mothers of Gynecology, shifting the narrative with one simple question: is if J. Marion Sims is the father of gynecology, then who are the mothers? And the final artist that I want to introduce you all to is Kadir Nelson. The oil painting that you see on the screen is called Henrietta Lacks, The Mother of Modern Medicine by Kadir Nelson, and is displayed in the Smithsonian's National Portrait Gallery. Kadir illustrates the deep-seated mistrust minority communities harbor towards medical research institutions. And in the photo, Henrietta Lacks is an African-American woman whose cancer cells were taken from her body without her knowledge or consent. Her cells are known as the HeLa cell, which has led to groundbreaking advancements such as the polio vaccine and cancer treatments. The painting portrays Henrietta with her hands crossed over her womb, signifying the origin of the HeLa cells, and her clutching her Bible, symbolizing her unwavering faith. You'll also see her red dress, adorned with floral patterns, symbolizing cell division, while the missing buttons on her dress underscore the cells taken without her consent. And the pearls around her neck represent the cancer that claimed her life. And of course, one of my favorites in the painting is the hexagonal wallpaper on the backdrop, featuring the flower of life, which symbolizes the immortality and growth, which of course reflects her legacy in science. So this artwork causes us to reflect the underrepresentation of minorities in medical research. And here in Detroit, we have a research program that is in collaboration with the local hospital. And I have a lot of patients that I work with that get calls to participate in research studies. And they often ask me my thoughts on them participating. And so a lot of my work as a CSW revolves around advocacy of educating them on their rights as a research participant, and also encouraging them to have open discussions with the coordinators of the program on how their samples will be used during and post research completion. So now what do we do with this artwork, right? So there are many ways that medical institutions and physicians can use art for racial healing. I've listed a few here, but for the sake of time, I'll only list two. One of those is to display culturally relevant art in healthcare settings. So this can create an environment that reflects the cultural diversity of patient populations. And from my advantage as a community health worker, I've witnessed how clinics and social service organizations use local and cultural art in their facilities to send a message to the patients, demonstrating the cultural awareness of their clinical team, but also assures patients that the facility is a supportive space where they can comfortably express their experiences. And secondly, using art to educate patients about health disparities can be highly effective. Using art to educate patients about health disparities partly are effective due to the cultural relevance of the art communicating intricate health issues and the historical context behind those, thereby enhancing patient comprehension and engagement in their healthcare journey. Thank you. It was a pleasure to be here with you all today. I'm going to pass it over to the next speaker, Miguel.
Thank you so much, Laura. Thank you so much to the Public Health Institute for the invitation to share with you today a couple of things. I'm going to tell you about my why. Why is it that I'm here? Which to some extent, sometimes it seems surreal that I can be sharing this space with amazing individuals. And also I'm going to tell you about what I'm going to be doing tomorrow, which is related to this talk. I'd like to begin by acknowledging my team from the Eastern Coachella Valley. To the right, you could see Cristina Mendez, Karen Borja, and Gabriel Perez. We worked on the development of a neighborhood leadership academy template for the city of Coachella. But I'd like to begin with this slide, which is a picture taken at the Castillo de Chapultepec in Mexico City, where I visited about 3 weeks ago. This landmark was built for what would have been the castle for a would-be European emperor who was supposed to be the king of Mexico, if you will, Maximilian of Habsburg. Now, that obviously didn't happen, but today this palace is a history museum which is filled with art, including monumental murals. Now, the idea of murals or muralism in Mexico City as a tool to teach history to the masses and to inspire the youth came from a guy named Jose Vasconcelos. He was the Secretary of Education under the Álvaro Obregón's presidency circa 1920s. In fact, he was responsible for the rise of three prominent muralists, and you know about him. You probably have heard of these guys. One is David Alfaro Siqueiros, Diego Rivera, and José Clemente Orozco. They were the recipients of scholarships that eventually allowed him to be the greatest muralist in Mexican history. Now, the vision of Vasconcelos' work, because I was deeply influenced by what I saw as a child in Mexico City, where I grew up, and I carry that impact with me when I moved to the US over 30 years ago. Now, when I came to the stage, one of the things that I was very fortunate to learn was how to frame pictures, and I became a professional picture framer. And eventually, I went on my own and I opened up a gallery, and I also started exhibiting the art of artists. And this was an impactful moment for me because I was, in a sense, expressing that influential aspect that came from my place of birth, Mexico City. Now, moving fast forward, once I received my degree in urban planning, I had this idea of integrating planning and the arts, and I came up with this project, which I called Art as a Vehicle to Understand Land Use Planning and Sustainability. I was able to convince 30 planners and 30 artists to collaborate on developing art that depicted urban planning concepts and issues. And we exhibited these works throughout our region in Riverside, California. And at the end of the day, we were able to showcase these works to audiences that we think counted to over 5,000 people. More recently, I was invited to actually work on a project that was quite unique for me. As it was mentioned before, I'm an artist, and I was invited to illustrate a graphic novel, How Did We Get Here? And this is the story of young people in the Eastern Coachella Valley who were working together to persuade the powers that be to open up a new university campus in the place where they live in Coachella. And all this, actually, the story happens during the pandemic. I collaborated with Juan Soria, who was the artist who wrote the script for the novel. Now, throughout my career, I had the fortune to partner with all kinds of different individuals from different professional fields. In this case, a few years ago, I worked with Peter Quintanilla, who is an urban designer from a company called Michael Baker International. We collaborated in the development of a parklet, which is basically a public space that only happens ad hoc. Well, traditionally used to happen more on a temporary basis, but now they're becoming more popular. In this case, we were preparing for an annual event called Parking Day. And this is the sketch. This was his vision of what the parklet could look like. And here is the actual parklet. And in this case, we invited community members to enjoy the space. And I have my colleague Eddie Jara there playing some music and inviting the community to actually join in and be part of creating community. I also had an opportunity to work with another artist in which he developed a temporary bus shelter in the Eastern Coachella Valley because there's a significant need of shady areas for the community who live in these rural areas. And as a result of this demonstration project, the bus shelter actually was built right across the street from where we did our demonstration project on a future site for a park in the community of Oasis, which is near the Salton Sea. Now, what I want to tell you about is the power of policy. A few years ago, well, actually in 2011, our department adopted a resolution, actually our Board of Supervisors adopted a resolution called Healthier Riverside County. And this resolution was instrumental for us because it enabled us to be able to work with other departments and community organizations that we hadn't really worked with in the past. And this was a very powerful moment because as a result of this resolution, we were able to create the Healthy Riverside County Initiative, which was moved through the Riverside County Health Coalition. At the time, our priorities had to do with improving nutrition for all, increasing daily physical activity, reducing tobacco exposure, and creating a healthy and safe physical built environment for all. This coalition eventually transitioned or created one separate space for those organizations and individuals who were interested in working on issues related to urban planning and community design. And we created the Healthy Cities Network. And the network was intended to connect community members with resources, to have a space for collaboration, to work on policy, and to involve the community to the extent possible. In 2019, we were able to quantify or actually account for about 45 policy efforts that collectively took place related to the explicit integration of health considerations into urban planning documents through general plans, through health initiatives, through the implementation of mandates at the state level. It has been a successful movement. And now we are moving towards recalibrating our Healthy Cities Network in the era of post-COVID, if you will. Our new iteration is the Healthy Cities Network 2.0, and we are intending to continue with the work that we started, but we are integrating other pieces like trauma-informed design, climate change, continue to work on land use planning issues, and we have been able to coalesce with so many different organizations that support our work, including the American Planning Association. But what I want to highlight from this diagram, I'm not intending to go deep into this, is the importance of communications. Communications is absolutely necessary to be able to succeed in terms of getting people motivated and excited about being healthier and improving their communities. And one of the new components that we want to integrate is art. So what if we are able to then connect the three pieces? And from my perspective, these are my three passions: planning, public health, and the arts. What could happen? So that is exactly what we're going to be exploring tomorrow during the next Riverside County Health Coalition meeting, where I will be proposing this idea of embedding our artists from Riverside County to help us to promote our messages and to be able to get people excited and encourage them to be part of a movement. So very quickly, I think my time is running out, but I want to highlight a few ideas of why arts and culture are important and why now. So first, recently I came across this book, Your Brain on Art, How the Arts Transform Us, by Susan Mack-Salmon and Ivy Russ. And to give you just the very gist of what you will find if you find this book, hopefully you'll get to read it. But the basic idea is that if we immerse ourselves in experiences that the arts take a part of, we can be happier and healthier. So I highly recommend this book. Now, Susan is also the founder and executive director of the International Arts and Mind Lab Center of Applied Neuroaesthetics at Johns Hopkins University. And I had the opportunity and pleasure to meet her. And as a result of that interaction, she was kind enough to invite me to a new movement that is happening at the national level, and is the creation of the Intentional Spaces Initiative. Last year, they held their first summit in DC, and I had the opportunity to talk to one of the featured speakers, Dr. Maria Rosario Jackson, who is the chair of the National Endowment for the Arts. Now, Dr. Jackson, by the way, also holds a degree in urban planning, so she's a big champion of this idea of coalescing with our urban planners to work on health in the arts. A few weeks ago, I had the opportunity to also attend a more local event. It was the Arts and Health Week Summit, hosted by the County of LA. And one of the things that I learned is that the Board of Supervisors actually just declare Arts and Health Week, and they encourage the integration of arts and culture into health. One of the featured speakers of that event was Dr. Barbara Ferrer, who is the director of the Public Health Department in LA County. So when your Board of Supervisors and your health director are behind these ideas, it can be very powerful. And, they're ahead of the game, and we are intending to follow on their footsteps. Riverside County and 28 cities, we are actually at the cusp of that integration. There's so many movements already happening, and we're intending to formalize, hopefully, that collaboration with our local artists and our local organizations. There are plans being done. One of them is a visionary document, a visionary plan called IE 2030, IE for the Inland Empire, which is a region which encompasses San Bernardino and Riverside County. And this document certainly has a guide for how we can improve community health through the arts. And finally, I'm going to do a call to action so that our coalition can begin to work on this incorporation of the arts and artists into the work that we do. And with that, I want to thank you, and it's been a pleasure sharing with you today.
I want to say thank you to everyone here who has been who's added so much to the presentations. I think you've heard a rich array of ways that we've integrated arts and culture and health together from our three panelists. And so now I really want to also bring everybody to the stage and really can have some discussion around this work. While folks are, I'll start with a few questions while Leah is kind of compiling the great group of questions that we've been seeing coming in. But let me remind you, if there are questions you'd like to ask, please do put them in the Q&A box. We really want to make sure this is interactive and that we meet your needs with that. So I'm going to synthesize a couple of the ones I've seen and just kind of ask our panelists to talk a little bit about if our audience wants to take the next step and they really want to integrate in and reach out and find artists and artist communities to work with. How do you go about connecting with artists that might be really strong, Black or Hispanic or LGBTQ or other artists that they'd like to work with to really engage in this work? So what's the best way to start?
Well, I'll start.
Great.
Thanks, Josh. Sorry.
For it.
So I would say I am a firm believer in having the courage to really engulf yourself in the communities in which you want to learn more from and to collaborate with, and particularly doing this in person. So I know just this past weekend, we had a African World Fest here in Detroit, where we have a lot of vendors selling African art and African adornments and things of that nature. And so having the courage to, of course, attend those festivals, get to know them and what their interests are, what their work is. And of course, just trying to identify if there are ways of interest of them wanting to collaborate with you. I think for so many of us, when we don't necessarily identify with the same race or ethnicity or socioeconomic background with certain folks, we tend to feel that we may not be welcomed or received well. But I think having the courage to purposely and unapologetically engulf yourselves in that community sets you apart as a public health professional to really break the status quo of what is expected from you. And so You know, if you are going to a festival that is primarily Hispanic, I know for me, Southwest Detroit is our primary Hispanic and Latin American community. I have to go to that community and engulf myself in it to learn from it. So that's what I would say.
Great. Love that. Be bold and intentional and go find folks. Yeah. Josh, Miguel, what would you add to that?
I agree with what Laura said, and I think to build on that a little bit, looking across artistic disciplines within your community to see what is the type of art that's being created and what are the themes the artists are focused on is a really great way to identify artists who many artists are already addressing public health issues. There may just not that may not be the language that they're using. And so looking for where that alignment is a really great place to start. Mighty Shades of Ebony is already well aligned with us. They're just not doing that specific work. And so that made for a really great collaboration. And I'd also think about how, as you're partnering with artists and creatives, whether it's individuals or organizations, in the way that you onboard them into the work and make it collaborative, you're also then kind of equipping them with information to then be ambassadors about the type of work that you're doing. So what we have seen is multiple artists or arts groups that we have engaged in this process. One was a photographer who had a newborn. He actually found lead in his home because of working on the project. A group that we're working with now that's a nonprofit just got a new building, and they tested it because they were commissioned to partner on this project, and they found lead in the building, and they serve young people. So it's really interesting to just see how through the collaboration that then kind of ripples out into how it impacts community.
Yeah, I think from my perspective, I would say that usually artists are well connected. There's a web. Creatives sort of come together naturally. In most communities do have an arts council or a museum or galleries, or there's hubs where artists actually come together, maybe the local coffee shop. So that could be one way to start, to find out where they meet and to go where they are and build a relationship. But the one place that I think sometimes is hidden before our eyes are art students in high schools. And I worked with high schools before, and we worked through the art teacher in one case. And that teacher was the conduit to actually work with young minds who created an art project to promote community health, actually in the vicinity of the Eastern Coachella Valley. So keep that in mind.
Those are great ideas. You know, and I think so often we think about inviting artists into our space, but reality is we go to theirs. You know, artists are every day working on health and well-being, and complex social issues and raising issues that we need to be able to explore together. So I think being able to tap into that and to they know how to bring people together. We're always trying to convene folks in public health. Artists already convene folks every day, and the work that they do gets them people talking at a deeper level. So I think that think about how do we find the spaces where they already got folks together, and then just add in how does it work with the health piece, and how do we integrate and partner there. The other reality is we are all artists at some level. And so my guess is most of us have some other connection in communities that relates to art, whether it be music or poetry or a social group that we connect with, or the visual arts, or we like to go to art museums and appreciate them. So think about how do we use those relationships to integrate into our own work as well. Yeah, super. So we have had several really kind of specific questions, Josh, around the billboards that you helped create. And so I'm wondering, we've had things like how much did they cost? How did you access funding for them? Were they new, or were they did they replace the old ones, or were they just an addition to the old ones? that kind of thing.
Yeah, absolutely. So in terms of the last question, all of these are existing billboard spaces. So generally, our messaging is replacing other messaging that is up. So we work with Outfront Media, and we look for, we do it based on zip code, and then look at the impressions that each one will get. So we go through a selection process for that, but also try to put them adjacent to where partners may be who are featured within them. In terms of the funding mechanisms for the billboards, the first two rounds, I believe, those were primarily grant funded. So we had an existing Pew grant that we were using for our health impact assessment. So that helped with some of our capacity as we were putting that together. And we had a few other small grants and a small sponsorship from a local business that paid for those billboard spaces. Everything after that has been part of the communications and marketing budget from Louisville Metro Department of Public Health. So when they had areas that were flagged for specific funding, you heard me mention a few different campaigns: smoking cessation, diabetes prevention, and now all of the childhood lead poisoning prevention campaigns. Those have been within their specific budgets. So they've paid for those. In terms of the cost for the billboards, we have been very fortunate to get discounts on all of the physical billboards so that we can use as much of our spend on digital ads as possible, because the digital ads are geofenced by zip code, and that's a click through to whatever website we want to send folks to. So we have slowly over time focused more budget from what's available on the digital ads compared to billboards, just because of that direct click through lands people on the website. But we still, for each campaign, use the physical billboards because that's a different way of engaging with people, and it's a way for community members to see themselves reflected in the community. The cost range, for example, for one campaign with 8 physical billboards, like the largest size billboards, the poster billboards, in well-positioned places beside a highway, high traffic places in community, and we'll estimate 1.5 million digital ad impressions. You're probably looking at around a $20,000, $25,000 price tag for all of those, which generates around 14 to 15 million impressions, depending on the billboards you pick.
That is super. We are having a thunderstorm emerge in my area, so I'm having to shift positions and places so we can hear. But I'm wondering if also we've had a question arise about frameworks used for storytelling. And Josh, you mentioned the motif framework. I wonder if you might tap into a little bit about how you chose that framework and how you developed that. And if there are frameworks that others of you have used or processes that you've used in communities to draw out community storytelling and to bring out community voice, how you might speak to those.
In terms of the motif framework, that was outlined actually in a retrospective way. So we looked back at the process that we used for One Poem at a Time and the ongoing campaigns after that, and then kind of distilled it into the motif framework for how could others in the public health space or otherwise think about taking this type of approach. So the way that we approached it was thinking about how do we identify priorities as a community, priorities either broadly, like I talked about beautification, or as we're thinking specifically about childhood lead poisoning prevention, going in to understand the community's understanding of that, what they value and prioritize in their community, in their home, a lot of different facets of that, and then move through a process of working collaboratively to distill the messaging, to reflect it back. Is what we've now kind of distilled and summarized reflective of your experience, and then creating the final campaign components for that. So as we move forward, we're talking to people who have used lead remediation resources. And so we've kind of created a prompt pathway of understanding what has that user journey been of accessing the resources, the challenges with it, the highlights of it, the recommendations for where there may be opportunities for improvement. And then all of that information will then inform both a campaign and potentially how the program evolves. So that's a little bit of how we've been thinking about it.
Right. Any other thoughts from Miguel or Laura on ways you've really engaged people locally for those conversations to raise narratives and change?
Yeah, I would say, even though I'm not necessarily involved in the art world, there are a lot of ways in which, as a community health worker, the patients that I work with are really the community informants for the work that we do within the organization that I work for. And so I work for a Medicaid and Medicare health plan. And so a lot of their preventative measures are related to preventative screenings, so mammograms, pap smears, colonoscopies, things of that nature. And so they have a whole communications team that actually works on some of their public health messaging to attract the attentions of our populations, to really see what they can do to bring them in to get those preventative screenings done. And what I have noticed is that working directly with the community, they will tell you specifically and exactly why they're not going to get those preventative screenings done. So for example, with colonoscopies, right? Anyone that has had a colonoscopy, they know that the process of getting a colonoscopy is not necessarily so pleasant for individuals. And so being able to report back to the health plan, specifically whether it is qualitative or quantitative or measurable or not, that they are not interested in getting the colonoscopy because of the process of drinking the solution. They don't want to go to the restroom a lot. They are not interested in going through the process of going through the colonoscopy. And so that is very important information, whether we want to believe it or not. It may not necessarily be attached to a metric, but that is what the community is informing us as to why they're skipping out on those colonoscopies. And so my job as community health worker is to report that information to the health plan so that they can, of course, change their messaging to encourage the patients to engage in their preventative screenings. So.
Super. We've also had a question related to the IE30 initiative, Miguel, and asking if you could talk a little bit more about that or link people to some further resources to find out about it.
Yeah, I added a link to a couple of people who asked the same question. So I don't know. I think I sent that link to you in a list. Is the last one, if you can maybe distribute it later. But basically, it was an effort that was done by one of our local universities, the University of California at Riverside, and they coalesced with a number of different community organizations, government departments to create this plan. They conducted a number of Zoom meetings and they created a template basically for what the region can become. This was in a sense I will say a more regional iteration of another project that was called California 100. In California 100 is a project that actually provides different scenarios for what the state of California can be. And actually one of the explorations that they do is the arts, the future of the arts and culture throughout the state. But IE 2030 is a more local iteration. The document is packed with ideas and recommendations for policies and actions. So what is really useful for me is that they have a section on how to improve community well-being, but also how we can work with our local artists to be part of that movement. Because sometimes we think about community organizing in bringing the community at large. But sometimes that is difficult because we may not have the connections or the relationships that some of our artists already have. So by working with them, we can access our ultimate, I'm going to say, targeted population, so that then we can bring them into our space and hopefully work on improving health outcomes.
Great. We've also had several questions around funding this kind of work. Many of us know about health funding sources, but not about funding sources in the arts and culture community. So I'm wondering if we could talk about potential funding sources to explore. And we've had the question about how to compensate artists. Do they usually give a quote? How do you best engage and compensate the work that they do?
So I can go ahead and dive in with that one. Getting a quote is a great way of understanding how artists value their time. And so that helps you understand what's feasible in terms of your ability to be able to work with and compensate them for the great work that they do. A lot of these efforts are, budget based. And so sometimes you already have the pot of money is available to you. So in those instances, our most recent campaign, we commissioned an arts organization to create a custom screen print design themed around childhood lead poisoning prevention that will then be used at community events. And so we came to them and we said, here's the amount of money that we have. Here's what we hope to achieve working with you all. Is this budget going to work? And if not, how do we need to re-envision what we'd like to achieve with it to make it feasible? And so that's another way of kind of being direct and upfront with, here's what's available, not just like, well, what could you do it for? And maybe but just, we were like very clear, here's what we have, here's what we want to achieve. And it did work for them, thankfully. But had they come back and said, well, we can do only 2 events, not 4, then that gives you some ground to kind of navigate around that. So I think those are 2 different ways that you can approach it based on, are you applying for funding, or is the funding already secured and now you need to figure out what you're able to do with the resource you have?
Some people have also asked actually about adding in the partner of higher education. And are there models or efforts that you can kind of do cross-training and joint learning and pull in the resources of public health and arts, but also, university systems of architecture, urban planning, graphic design? How many of you have kind of linked to the higher education aspect as well?
I can give you another idea, maybe not necessarily answering that question, Kathy, but I think one strategy to be able to compensate artists is that when we, in my case, the Department of Public Health writes grants applications, we have in mind bringing artists to be part of the implementation of our project. And we have one example called the Clean California Local Grant Program. We were able to secure $2.2 million to beautify one of the communities in the Eastern Coachella Valley, which I actually mentioned, Oasis. And as part of our application, we invited 2 organizations that work with artists to be part of beautifying the area. One was Raíces Cultura, and the other one was the Scrap Gallery. So everything they do is community engagement, education, beautification through the arts. So for us, government, that is an opportunity. But if government is not necessarily aware of the power of the arts, no one will incorporate artists as part of or traditional type of work to do community engagement.
You bet. Several of our audience members have also shared initiatives that they've done or been involved in or used. And so I'm hoping maybe they've sent us links to those. So one of the things I think we'll do is try to compile those and include that with the slides that go out as well. Well, I'm going to close this out with one more question here. We've done a lot of talking about how to partner between arts and health and culture sectors and the logistics of that. Talk to me a little bit about why it's why it's so important and why it works. There really is a growing amount, as Miguel mentioned, of science of what arts does and how it works in our brains and our formation of relationship and our own health and well-being individually and collectively as communities. I wonder if you could share a little bit about that, Miguel. Maybe we can start with you, and then also tap into Josh and Laura from your own experience. Why are the arts so effective in strengthening health?
Yeah, this is an excellent question. I think from my point of view, I'm going to echo the idea that you mentioned earlier, Kathy, that we are all artists. I think inherently as human beings, we come equipped to be creatives. We come equipped to imagine. We come equipped to do things, to build things, to share things. And those are components of those who traditionally stay on the path of the arts. As children, we all exercise, I would say 99% of people experience the arts through making or just imagining. Imagination is an essential component of being an artist. So that in a sense is a common denominator that unites us. And I think that's why it's powerful, because when we experience somebody practicing their art, we can understand, or that idea of why they are expressing what they're thinking. And in turn, we learn once we dive into wanting to know more about it. But I wanted to share a quote from your Brain on Art website, which is, I think, really powerful. And it comes from these emerging practitioners and researchers in neuroscience, in the arts. It's a movement. And what they're saying, the quote says, "We are standing on the verge of a cultural shift in which the arts can deliver potent, accessible, proven health and well-being solutions to billions of people." And that starts at the local level. And that's why I'm going to do what I'm going to be doing tomorrow, to start tapping into that, because it's happening and it's powerful.
It is happening. And I think Dr. Magnus really points out the science behind that and how it changes how our brains interact with the world. You see activity in the parts of our brains that trigger emotion, that build connections that we wouldn't otherwise see, that get at deeper issues, and that are meaning making. How do we see the world, and how can we collectively, as we share that, we come up with solutions at deeper levels that we might not have otherwise have seen. Josh and Laura, any last thoughts from your end in terms of why this is so effective and how we can tap into it moving forward?
Yeah, I would say, of course, cultural relevance enhances engagement with the community. I think a lot of times, especially if it is a local artist, the community or the public, if they're familiar with that artist, there is just a certain level of trust that the community has as it relates to the messaging that that artist is giving, whether it's through a canvas, a poem, or in the marketing. I think local artists have a particular influence in being able to push across messages for the community to participate in a lot of behavior change. So I think undoubtedly cultural relevance is a huge aspect and feature of artists in public health for sure.
The facet I might add to what they both share, which I agree with, those different facets, would be that language can often be a barrier to us connecting into and understanding different experiences. And art really meets people where they are. And it can be one of those things that transcends language. It can transcend different cultures, different backgrounds and experiences. So it really can shift how we relate to each other, how we understand health and well-being in general. And also how we think about what the future looks like and can help us envision different, healthier futures that we may not have considered before.
Well said. Well said. So I want to say thank you to all of you. Thanks for joining us today for the second webinar in our Masterclass series. If you missed the first one, you can find that in the Dialogue for Health website. And then this one also has been taped and will be posted there, as well as the slides and resources that we've talked about. If you're interested in the Leadership Academy or any of those run by the CHLI, please do look at the leadershipacademy.health website. You can find out more about how to apply to those programs. If there are topics that you'd like to focus on in future webinars, please drop those in the Q&A box or at the contact us website there on the screen, because we really would love to hear those and think about what we can best do to support you moving forward. As you know, these broadcasts never come together without a whole team. So I really do want to really thank sincerely Josh and Laura and Miguel for sharing their work and their insights and their expertise with us. It is really invaluable and inspiring in so many ways. We've learned so much through each of you. I also want to thank the Dialogue for Health team that helped produce the webinar, especially Merlene and Jeff and Leah, who are always a class act and make this kind of work both professional and fun. So thank you to all of them. We have to thank our sponsors, the Center for Health Leadership and Practice and the Public Health Institute. They are wonderful partners, and I so enjoy working with them. And then I think most importantly, I want to say thank you to you, our audience, both for attending today and really for the work that you do every day in communities. Really hope that the event has sparked new partnership ideas, has helped you tap into the power of your own creativity, because it's absolutely there, as we heard from our panelists today, and that we've offered you some resources that you can take and learn more from and put this to work. So in closing, I will close us out with a quote from the artist Richard Kamler, who said, "Art is our one true global language. It speaks to our need to reveal, to heal, and to transform. It transcends our ordinary lives and lets us imagine what is possible." So we hope the ideas we've shared today and the ways you creatively apply them in your own community do just that for you. So thanks so for joining us. Good afternoon.